Endoscopic double bypass for advanced pancreatic tumors. We present two cases. We will start by the first case. 60 years male presented with obstructive jaundice and persistent vomiting. CT abdomen revealed extrahepatic biliary obstruction and gastric outlet obstruction from advanced pancreatic head mass. Bilirubin was 15 mg per deciliter. Patient was scheduled for double bypass. We started by ES evaluation showing the mass and dilated CBD. Then we take biopsy from the pancreatic head mass using 22G acquired needle from Boston Scientific. After that, we started puncture of the common bile duct using 19G needle ecotip from Cook Medical. Dye injection followed by after aspiration of bile to confirm dilated CBD. Then a 0.035 wire was inserted towards the hilum, which is Boston Scientific wire. Track creation using 6 French cystotome from Tai Wong. Then we inserted 8 cm partially covered stent from Boston Scientific. We started deployment under fluoroscopic guidance and endoscopic guidance till fully deployed stent in the duodenal bulb. We can see here the endoscopic view of the malignant obstruction with the hepaticogastrostomy stent in the duodenal bulb. After that, we passed the guide wire under fluoroscopic guidance, guide wire from Boston Scientific, and the standard cannula also from Boston Scientific. Under fluoroscopic guidance, we assessed the length of the structure. We can see here the endoscopic view of the 0.035 wire from Boston. Then uncovered duodenal stent 11 cm from Boston Scientific also was inserted over the wire, and the stent started to be deployed under fluoroscopic guidance. This is the endoscopic view of the Boston Scientific stent passing through the duodenal structure. Then we can see fully deployed stent into the duodenal bulb. Now we can see both stent, either biliary choledochronostomy stent or duodenal stent, both from Boston Scientific, passing the duodenal obstruction and the biliary obstruction. And this is the final endoscopic view with the Boston Scientific partially covered biliary stent and the Boston Scientific uncovered 11 cm duodenal stent as endoscopic bypass for advanced pancreatic head mass causing biliary and duodenal obstruction. Patient showed no fever or abdominal pain after the procedure, and they started oral feeding after 48 hours. Bilirubin decreased to 5 mg per deciliter, and pathology was adenocarcinoma. Patient is following with oncology. The second case also is double bypass for malignant biliary obstruction presented with advanced pancreatic head mass and elevated bilirubin to 12 mg per deciliter. This time we go for EOS guided hepaticogastrostomy. We evaluate dilated left hepatic ducts. Then a 19G needle from Cook Medical was used to puncture the dilated biliary system. After that, we injected dye and passed a 0.035 wire from Boston Scientific towards the common bile duct. Then we inserted a 10 French cystotome from Cook Medical, this time for creation of the track. Then after that, we inserted half uncovered stent from Hanaro for hepaticogastrostomy. Under fluoroscopic guidance, we opened the stent from the left hepatic duct into the stomach, fully deployed into the stomach. We can see here the half covered, half uncovered the stent from Hanaro opened into the stomach with good bile flow inside the stomach. Then we started doing the second bypass by insertion of the duodenal stent. After insertion of guide wire and standard cannula from Boston, we inserted 9 cm uncovered stent, and finally we can see both stents deployed, the hepaticogastrostomy stent from Hanaro and the duodenal stent uncovered from Boston with good clinical outcome for the patient. After that, patient bilirubin decreased to 4 mg per deciliter, and he started oral feeding after 48 hours and is discharged to oncology center. Thank you.